We are back. That's right. We are back to the Race and Ethnic Relations on Campus podcast show. My name is Dr. B. And welcome back to our show. This is show number 48. Show number 48, and it's entitled Race and Vaccinations for COVID-19. That's right. Race and Vaccinations for COVID-19. It is March 6th, 2021, and we're moving right along. February went by so fast. I had so many things to do, and just couldn't get around to a podcast show during February. But right now, it's the month of March, the first part of March. And let me just say right up front, I want to thank our podcast listeners, our platforms. I want to thank Podbean. Let me take care of Podbean. I want to thank iHeartRadio. I want to thank iTunes, Apple Podcasts, Google Play. Also, Amazon Prime. I think we're on. Yes, we're on Amazon Prime. Thank you, Amazon. But I really want to thank as well as every platform. I want to thank iTunes. I said iTunes. Tune in. Listen FM. And again, I want to thank my publisher of my book, ABC Clio 2018 book, Race and Ethnic Relations on Campus. Still going strong in 2021. And matter of fact, my class is truly enjoying the book. My race and ethnic relations class truly enjoying the book. So again, these are very relevant issues today. And that's the reason why I wanted to take my time and see what's happening nationally. And what is happening nationally. And as you know, we have a new administration, President Biden and Kamala Harris, and the federal government is responding in a different way. But what the biggest issue now is, and I have to just ask some basic questions, okay? Let's ask some real serious basic questions about the vaccinations that are coming out, that people are getting across the country for COVID-19, and how race is being played out in this rollout is very political already. Now let me just remind folks that we went through an entire, now we're almost on the entire year of being shut down, readjusting everyone's life with regards to the outbreak of COVID-19, the impact, the lives lost to COVID-19, not being prepared, just not knowing what to do. And those who unfortunately who were most affected, lost their lives, the vulnerable population segments of our country. And you know who they are. The elderly, the very young, and communities of color, the underserved, in every community. The low income, the impoverished. Yet now the data really shows that race is a part of the equation. We've had the data. We got more and more data. Every institution is doing all these studies on the impact of COVID-19 in their state, in their communities. And without a doubt, the high risk folks segment are communities of color, African American, Hispanic Latinos, Native Americans, Asian Pacific Islanders. Think about the data is there. And think about how and when the outbreak was occurring last year. And then they were talking about all the major leaders. Now here we go. All the major leaders, past president, current president, new current president, but also leaders in high-ranking federal institutions. Let me just say CDC, NIH, Department of Health and Human Services, Surgeon General. All the major medical leaders, okay? And once we started to get a handle on things late last year and rushing to come up with vaccines, the enormous impact, the fast turnaround, the immediate fast, because again, we thought initially it was going to take two years and going through trials and again, I'm going to say this, even I used to work at NIH, okay? Now, let me just say this. Dr. B used to work at NIH, and NIH has certain protocols, and even Dr. Fauci, who's the director of the Institute of Infectious Disease and Allergy and Immunity, NIAID, and again, the regular protocol usually takes vaccines for 2 years or going through trials and trial one. But of course, they rushed it. They were able to expedite and move it forward very fast. You have to give the government props. Let me just say, give props to the government to really moving the envelope forward and put it on a fast track. Encourage all these companies who are pharmaceutical companies that we need a collaboration to speed up once we figured out the vaccine, put it in trials, and then get it out there. Once the trials were out there, we were able to appropriate certain companies to mass produce these vaccines. And don't forget, back then, they were saying, all the leaders were saying, we need to vaccinate. Once a vaccine is out there, we need to vaccinate those who are most vulnerable. Those who are losing their lives at a higher rate than the rest of the population. And those who were losing their lives more than the rest of the populations were African Americans, Hispanic Latinos, Native Americans, Asian Pacific Islanders. It was race. It was race. And then, of course, in certain areas, it was also seniors, obviously, the elderly and senior citizens facilities. We know what's happened in New York City. I'm not even going to go there. But a lot of senior facilities, care facilities across the country, those who are institutionalized, those who are unfortunately incarcerated. That's where a lot of the unfortunate deaths occurred due to COVID. The high density populations, those who have lung problems related to, again, high risk cases, and unfortunately, it happened among thousands of folks, and unfortunately, the numbers show that it was. Back then, when we started to get the numbers again and again, it was happening in communities of color. And that's when a lot of organizations start to speak up. Hello. And what I mean by community organizations, ethnic organizations like NAACP, Hispanic Association, Hispanic Medical Association, the National Medical Association, affiliated with African American physicians. And they were speaking up saying, when you do get a vaccine, the number one priority population, number one and two should be our populations, communities of color. Well, now it's March 2021. Guess what's happening now in the massive rollout? You know what's happening across our country. Those who are getting the vaccines, it is sad that the people, it's so easy how we forget what's going on in our country. It's so easy to forget what's going on in our country. And what we said just a few months ago. I said we as institutions and leaders, what our leadership said, and said, when the vaccinations will roll out, we will provide it for the most vulnerable populations. It's March 2021. I asked the question to each and every one of you, and I want your response. Are the most vulnerable folks getting the vaccinations now? Hello. Are the most vulnerable populations in the United States, from state to state, from region to region, from rural to urban, to inner city, across the United States? Are the most vulnerable folks, are they the high priority to get vaccinated now in 2021? My answer is no. My answer is no. What I hear and what I see is that there's certain groups that are fast track, getting in line first. Check this out. Getting in line first. Because they consider themselves high priority. I'm just going to say it. Higher priority than those who are already dying at a higher rate. Hello. They're jumping the line. They're jumping the line. Hello. Those segments of the populations who now in March 2021 have been, I don't know, relabeled as a priority segment to get vaccinated, versus if we have the data and we don't allow, leadership should say, wait a minute, check, time out, check, 1 2 1 2, check. Let's look at the data, and we're supposed to be going by the data. Those who unfortunately having the most ill effects and who have lost their lives are communities of color. They and we, hello, I'm a part of it, should be priority number 1 and 2. Everybody else, I'm just going to say, everybody else, you're lower, you're lower on the priority list. Everybody else should be lower on the priority list. We have the elderly. We have those who are already medical high risk segments. Then we have the different racial and ethnic groups. Dare I say, I'm going to say this because I mean this is what I'm observing. How in the heck do teachers? And I love teachers. I'm in education. But how does teachers jump the shark, jump the line? Yes, they have to teach younger the kids, teach college kids like I'm doing. But I even reassess myself. I said, wait a minute. I can't jump the line. I can't jump the line just because I'm in education. Yet the more vulnerable folks are the underserved communities of color, and which I'm a part of. But again, there's I can not separate, but I can see how their situation is much more vulnerable than mine. Hello. So again, now we get into the ethics of race and vaccinations for COVID-19. The ethics. And I can't believe those who are in public health and medicine. Let me just say, I'm kind of calling out public health and medicine folks to look at your data and think about when you are going to get vaccinated. Are there more people who could get that vaccination first before you? Because many folks that I know are not in a high-risk category. Really not in a high-risk category. They're not in a high-risk category. But they're taking advantage of their status. Taking advantage of their status. Hello. And jumping the line. Think about it. This goes into ethics. The moral ethics of race and vaccination. Again, that's the reason why I'm just observing and seeing how our new administration, doing a great job pushing the new. I just saw the it wasn't even a press conference, but it was a statement. Biden hasn't held a press conference yet, but it was a statement saying that the new rollout, everyone will be vaccinated by May, March, and then May. But the number one priority, folks, are teachers, the union, teachers. It's not the number one priority are African Americans, Hispanic, Latinos, Native Americans, Asian Pacific. It wasn't by race. It was by job. Oh, that's what I'm saying. It was by jobs. But the data shows that race is an issue, not your job. Hello, race, not job. So I encourage everyone to look at your local news, look at the data, and just go back a few months ago when we were developing this vaccine, starting the trials of the vaccinations. And what did our leaders say when we were going to come out and roll out the vaccinations? What did our leaders say? They said, we're going to get this vaccination out to the most vulnerable folks. Well, look what's happening now, just a few months later. And we are not remembering what we said. We are changing the script. We are changing the public health and medical priority. And we're seeing it unroll and happening right now. We're seeing it. We're in the midst of this right now. And to me, it's a shame. It's a shame. It's a shame. In any public health priority, this is what I learned in public health, and particularly working for the federal government. We always, when there's a major outbreak, you always try to address and develop initiatives for the most high-risk segment of the population. And then the rest of the population can make adjustments. Their health, their risk is not near as high a risk than another segment of the population. So you always, and this is basic 101 public health and medicine, you always go straight to those populations that are the most high risk and provide vaccinations, strategies to get a handle on an outbreak such as this. And therefore, the drastic numbers will dramatically reduce. So this is an excellent example of public health medicine being politicized in our country right now. We're living through this global pandemic, and we're seeing how the United States still is not recognizing the impact of race in our country. Still in 2021. Just my observation. Waiting for our system to really take initiatives and address this COVID-19. Now we're coming on the other side and roll it out for the most vulnerable populations immediately. And yes, race is in the equation. That's our responsibility as a democratic society. Take care of the most vulnerable first. And the rest of society will benefit. Hello. That's what we say we're all about. But when it actually happened, things really happen, you see what really happens. Things get politicized. Higher priorities somehow come into the equation. Talk is cheap. Talk is still cheap in 2021. And dare I say, let me just say this. I'm just going to say it. Is the administration will be called out on this. Some organizations will be called out on this, because I'm pretty sure the National Medical Association, National Hispanic Medical Association, will call out various organizations and distributors of vaccines, and our collaboration with the pharmaceutical companies, in getting their vaccinations out to the most vulnerable segments of the population first, and then the rest of the population second and third. So again, I'm so glad that we're getting the vaccinations out. We have this massive rollout, but unfortunately, it's being delayed. Many times when you hear about the vaccinations, everyone gets excited, but here's the process. How do you distribute this massive vaccinations? Do you have massive vaccination sites, or do you roll it out at pharmacies? Do you roll it out at medical facilities? It's so much confusion now. It's so much confusion. Yet the priorities, the leadership could have stuck to what they initially said. That is, we're going to vaccinate the most vulnerable folks first. Everyone else just simply have to wait. It's that simple. Everyone else simply have to wait. But no. Those who have certain social status, certain jobs, have jumped the line. So I just want those of you who have jumped the line, how do you think about it? How do you feel? When you know there's so many other vulnerable folks just can't even get a shot because of transportation, because they're in the rural community, way in the rural community with no resources. They don't have any support system. They don't have any group, network to speak for them. So again, think about what we're doing in this country. It comes back to, well, yeah, I feel so sorry for those populations, but when it comes down for me getting a vaccination, I'm going to jump the line. See, that's where you got to slow down. And unfortunately, even in 2021, race is still a part of the equation on many things. And as you can see in the vaccination rollout, race is still a part of this equation. Hello. So with that said, I'm 24 minutes. I didn't think I was going to go this long, but it's fascinating. Again, organizations, leaders, try to say the right thing. But when things actually happen, you look at the behavior, you look at the response in that time period, and then you just say, let's slow down. What did they initially say? Completely different. And then what are they actually doing? Completely different. So again, that's unfortunate, but I'm sure we're going to have more to say about this in the weeks and months to come. And I'll probably do another show in May or June and see what happened in the vaccination rate. I'm feeling good, but I just want to hear the response from specific populations and how they feel about it, and why have they, us, been left out. Hello. This is I'm back. I'm back. We're taking it up another level in 2021. We're taking it up another level in 2021. This is Race and Ethnic Relations on Campus podcast show. I am Dr. B. All these, by the way, all the comments are Dr. B. Okay, I try to be as politically correct as possible, but not in this show. I have to, push the envelope. Of course, we should be able to push the envelope on these podcast shows. This is show number 48, Race and Vaccinations for COVID-19. I want to thank, again, my platform, Podbean. I want to thank Podbean. I want to thank iTunes, Apple Podcasts, Google Play. I want to thank TuneIn. I want to thank Listen FM. I want to thank iHeartRadio. And of course, Amazon Prime, and as well as my publisher, ABC Clio. Thank you for publishing my book, 2018. Man, we just getting started in 2021. Hold on, folks, and I'm sure things are getting better, and it's good to see that we will get back to normalcy within a few months, hopefully. I got my fingers crossed. Every month is a better month, so hang in there. Practice social distancing. Continue to wash your hands. Continue to wear your mask. Insert in places. So yeah, I'm down with that. Okay. I'm definitely following that. So again, it's those basic strategies to protect yourself, your loved ones, and other citizens. This is Dr. B. We out. I'm out.